Just waiting for the followers to join. Okay, perfect. Hi everyone, I'm here at the clinic today. I'm Debbie Thomas, the owner and founder of the D Thomas Clinic, and really excited today. We're actually got an opportunity to talk to the guys over at Linton Lasers, who have provided me with the latest piece of equipment we brought into the clinic, which everyone loves at the moment, which is our wonderful machine here, the Focus Jewel. And it does two different types of technology. It does something called Haifu and it does something called radio frequency microneedling. So what I'm going to do is just introduce to you, or bring in Hayley Jones from Linton, and we're going to be able to basically go over any questions that you have got about this device, my personal experiences using it in the clinic, and then obviously Hayley's experience, because she's been working for it for much longer. So I am just going to add in Hayley now. Just taking me a moment. Sorry everyone, I'm struggling to try and get this to actually come up. You tell I haven't done it for quite a while. Here we go. Linton Lasers. Joined. I'm trying to get you to join me, guys. Oh, perfect. I've done it. Excellent. Sorry about that, guys. Technical fault. I'm obviously not very good at doing these things. Hi. So,
Hi.
Lovely to have you join us. So this is Hayley Jones, everyone, who obviously works down at the head office at Linton, and she's obviously got lots and lots of knowledge about the dual focus. So we're going to combine our overall knowledge of experience from a user perspective, and then obviously Hayley's extra information that she's going to throw at us. So how are you today, Hayley?
I'm really good, thank you. Yes, I'm about to hop on a train to London because we have our Focus Jewel press event tomorrow. So I'm looking forward to that. Get to treat some good editors and get the word out there. So thanks for coming. I know you're joining us tomorrow morning, aren't you?
Yes. Yeah, no, I'm really excited. It should be a great event.
Well, we're really delighted to have you there because, I mean, it's fair to say that you are quite renowned in our industry for your expertise of treating skin. I mean, I've been in the aesthetics industry for about 20 years, and I've been hearing that name, Debbie Thomas, you know, everywhere. So for those of you that don't know, Debbie is quite special in our industry. And that is because you are very, very serious, aren't you, about meeting your customers' needs. And is it fair to say a bit skeptical sometimes about new equipment that you bring into the clinic?
Yeah, I mean, well, first of all, my focus above and beyond everything else, and I was one of the first people to do this within the aesthetic realm, is focusing on skin. I wasn't, you know, obviously I wasn't doing Botox, I wasn't doing fillers, I wasn't doing anything surgical. I was all about what can I use to make people's skin as amazing that they can, and what results can I get for them, and how do I get the best results for each individual person and each individual concern. So I've really hunted out a plethora of different kind of devices to just give great results. I mean, that's all we all want, really, is the most amazing results. So that's my focus. But yeah, I've seen it all, and I've worked with pretty much everything. So if I'm going to take something new into the clinic, it has to have definitely has to have an edge, but it also has to have some really good clinical data behind it.
And so is that sort of your main thought process when you're bringing in new equipment? Are you looking mostly at what your customers are looking for, gaps in the market? Yeah, I guess it'd be interesting for your customers to know the thought process you go through when you bring in new technology.
Yeah, I mean, okay, from a starting perspective, if you're just sort of starting out in the industry, or you're just about to invest in your first piece of equipment, what you really want is something that you can probably treat multiple issues with, because you want that piece of equipment to work quite hard for you. as you start to build your toolbox, as I call it, yeah, each time I bring something new in, I'm looking for something that can, I'll know that there's a gap that I'm missing out on. So obviously, if we're talking about the Haifu today, it's lifting. It's really good, deep lifting, but with minimal side effects. So I've avoided some of the older machines, and I've avoided some of the older technologies, because there has still been that element of risk that I wasn't as happy with. And also there wasn't a lot of clinical data available. Now, you know, when I was looking through everything that was available, I knew that it was a Highfu machine that I needed. And then it was narrowing down a brand that I could confidently work with, that I felt that would meet my needs and the needs of my consumers. So yeah, really important.
And obviously the Focus Dual does have the Haifu, and it has the radio frequency microneedling. What for you is the most popular in your clinic at the moment?
Right now, we're probably doing 50-50.
Okay.
I'm sure that will even out with time, and maybe the RF needling might be the thing, because you can do that more regularly after you've done your initial course. Haifu doesn't need to be done as much, but really what they do for the skin is different. So, you know, everyone wants to, I don't know, get rid of their lines and wrinkles, but then you also have the people that have other textural issues, whether it's scarring or open pores, or, you know, that crepiness within their skin. So that is going to be your RF needling all day long. What I really love about the RF needling as well is that you can come right up onto the lower upper lip, you can come right around the eye area, you can go across the eyelid. So you get lift, you get that tightening through those delicate areas that you can't normally treat easily with other devices. But you cannot get a lift like you can with the Haifu from any other device. So we obviously have clients that are doing both, and then we have clients that would prefer one over the other because of their actual skin quality.
Yeah. And that's interesting when you mention about the lift, because that is because Haifu is quite unique, isn't it, in the way that it interacts with the tissue. And this is now reaching the SMAS layer, isn't it?
Yeah. So what I started looking at Haifu probably about 3 years ago, seriously. Obviously, there was a period where we weren't really investing in anything because we were closed. So it did take me a while to actually find the device I wanted to work with. And yeah, understanding how Haifu works. So Haifu stands for High Intensity Focused Ultrasound. So we have the original ultrasound machines still out there. And what they tend to do is bulk heat to all of the tissue from the surface all the way down to, and they can potentially reach the SMAS layer a little bit, but they cause so much heating up in the upper layers that there is that risk of losing volume, breaking down fat, and things like that, and how much energy you could potentially get into the SMAS layer without causing too much injury to the upper layers was always debatable. So with high intensity focused ultrasound, the delivery system is completely different, and what it does is it allows the energy to bypass the upper layers and just to focus a point of energy down where we want it. So we've got 3 filters that we use typically for the face. We have one that reaches the SMAS layer, which is your lift. That's your deep lifting that you can't achieve really with anything else. You have to hit that SMAS layer. And the SMAS layer is the layer that connects the skin to the muscle. And you only actually have SMAS sort of in this upper area of the face, neck, and a little bit on the chest. You don't have it anywhere else on the body. And it's the tissue that we think, the reason it's there is to connect the skin to the muscle to allow for expressions. But what it does mean is that's a perfect layer for us to target when we're doing a treatment like this, because by tightening up that bond between muscles, which typically tend to be quite strong and firm, and the skin, is that, you know, the skin sort of moving around a little bit and losing some of its elasticity, by pulling those strands tighter and firmer, it will pull your skin back up into place. And that is also the layer that when you have a facelift, they do actually do quite a lot of work with your SMAS layer, and that's the layer that they will pull to to also to do that tightening. So we can do some of that without having to cause obviously a surgical kind of wound in any way, which is amazing. But then you also still have the filters in exactly the same way by using this very focused point where we create the heat exactly where we want it to tighten up the dermis and the epidermis as well.
Yeah, and that's really key, isn't it? That you can layer, can't you? So when you're faced with a skin that maybe has very mild laxity versus a skin that's got more moderate laxity, you can kind of pick and choose what and how to treat them, really.
Yeah, I mean the skill with using any device is really getting your head around what you should be doing on an individual case-by-case basis. You know, as much as you have a standardized protocol that you kind of start with, you should very quickly start taking a lot of note of you know, individual cases and how to get the best response, and you will need to tweak what you do, and having a flexibility of being able to use these different depths of penetration and things like that is great. And the other thing that I liked about the Focus Dual is that it has an even newer delivery system than quite a lot of the other Haifus on the market, because it's created a way of delivering the energy. Because do you know what I'd really love right now? A flip chart so I can do it. So it's a concave delivery system, and these little beams of light come out of the concaves, and that's the same with all Haifu. And it's only where all the beams of light join that you create the heat. And so by having a different angle, you can obviously get that energy to go into a different layer.
Yes.
With most other Haifus, they do exactly the same thing, but they have the energy coming out of the whole entire thing, including the middle section. And when it's coming out of the middle section, they're quite close together. So you do actually get some heat building up in that middle section. Nowhere to the extent of traditional ultrasound, but there is still then that tiny bit more increased risk of the loss of volume and things like that. What Linton have done with the Focus Dual is they've got enough energy that's coming from the sides that they don't actually have to have energy coming down the middle. So you never get the beams going close enough to create heat until they do meet in that precise point. And that for me was the reason really that I went for this device, because you know I just want to reduce the risks, even if they are small. If we can make them smaller, then that's got to be what we do.
Safety first, definitely. I love that explanation. It was really clear, even without a flip chart. Well done. It did make me think of Ghostbusters and crossing the beams at one point, though. So
yes, exactly. Never cross the beams, apart from when you want to get some lifting, and then you cross them just a little bit.
Perfect. And so, what do you explain to your customers to expect from the treatment? What do you say they can expect to see as a result of having 1 session, 3 sessions of the Focus Dual?
I mean, for me, I always talk about, you know, worst case scenario, because you have to have realistic expectations. You know, if you're going into a clinic as a customer, you know, we may have the best machines, but we can only get your skin to do what it would do naturally. And some people respond 100 times better than other people. It's nothing to do with the equipment or the practitioner. It's just your genetics. Yeah. However, you should always get some improvement in some way. And that's, again, when you are working with a practitioner who can really look at your skin and give you the correct advice. But for most of our clients, I always say to them 3 sessions is going to give you your optimum result. And that should ideally be within a 4-month period. So you may have the first ones a month apart, and then the next one could be 6, 8 weeks, 10 weeks, you know, sort of after the second one, to get the best results. And you're looking at 6 to 9 months to really fully see the extent of your, you know, the full benefits of the treatment. In terms of follow-up appointments, again, I think you have to individualize it and sort of understand people's, you know, if someone has got a lot of loss of elasticity and everything like that, I would probably be recommending every 6 to 9 months that they have a session done. If someone is younger but just doing some preventative work, then I would probably say every 12 to 18 months, maybe just have a session done. So again, individual people, you have to make sure it's working for them.
I think you touch on a really interesting point there, because I'm sure you've found it the case that our demographic of people coming into aesthetic clinics nowadays is getting younger and younger. And we're seeing people now in their mid-20s who are having preventative aging treatments that I think, even 5 years ago we weren't seeing, perhaps, those skins. So I think that's really interesting. And I mean, personally, for me, this is my treatment of choice, because I think based on, my bone structure is quite good, but I know, looking at my mum, that this is the bit that's going to get me, as I age. So I will now have these treatments just purely preventatively, in order to stop that from happening as best as I possibly can moving forwards.
I mean, for me, the way that I explain it to people, it's about having healthy skin. And healthy skin is about increasing the cellular renewal, increasing your collagen production, increasing circulation, and also lymphatic drainage. Unfortunately, as we will all know, after the age of 25, that all just starts to slow down just a little bit. By the time you hit 35, you'll start to just notice a bit more what that means for you. So whether it is my mum's got a bit of that and I can now see it's just starting on me, or, it's sort of the smile lines are looking a bit more there, or whatever it is. And then by the time you get to 45, I think you definitely know how your aging is going to go. But what you can do from much earlier is just do treatments that help to promote health within your skin. Because if your skin is healthy, that's the main difference. So 25 and 55-year-old skin, it's the health. And the reason that the health of your skin reduces is, number one, obviously genetics and hormones changing within the body, slowing things down. That's what happens. That's what menopause is. It's the slowing down of the body, because your hormones sort of think that we're not needed anymore. They disappear, essentially. So we have to counteract that by doing treatments which stimulate all of that renewal. And I think there's a lot of people out there who worry that if they do stuff now, that it's going to not work later, or they're going to run out of collagen, or they're going to run out of skin cells. You make new collagen and new skin cells up until the day that you die. It's just that you make them at a much, much, much reduced rate. But with certain treatments and consistently improving the health of your skin, you can slow that whole process right down and keep some good regeneration going throughout the years.
Absolutely. And this is what the celebrities are doing, isn't it? So there's a reason that people look so good now at 50. No one ever used to look as good as they do now when they hit 50. And it's because people are blending energy-based devices on a regular basis with little tweaks here and there, aren't they? And just rather than a big fix of a problem, more little bit and often, in order to create the skin, as you say, keep the skin as healthy as possible.
I mean, talking about tweakments, I quite regularly have Botox and fillers done. I'm now 43.
Looking fabulous.
I have quite a lot of filler done normally, but a lot everywhere rather than in one area. So most people don't ever notice. I actually haven't had any put in for about 18 months. And I do normally have it done every 6 months. And if I don't have it done around the 6-month mark, I start to feel a bit self-conscious. Nothing major, but I just feel like I look a bit more tired, and I don't have quite, the shape of the face changes a little bit. And having the combination of the RF needling and the Haifu, for me, has really made me feel confident enough I'm not that bothered about getting my fill. I'm not saying I'm not going to have it done again. I will. There is a place for everything, and you need a little bit of different things. But it certainly reduced my need to have it as often as I was, which I think is great for me personally.
Brilliant. Should we perhaps then just round up, Debbie, by doing a quick run through of the solutions that the Focus Jewel offers for a skin? So if you could sort of summarise for us the sorts of indications that it can treat, and then if people are watching and they're interested in having a treatment with you, they've got an idea as to what solutions you might have available.
So we've got 2 different machines in one, really. So we have the Haifu, which I've said is the high intensity focused ultrasound. The only thing that Haifu does is it lifts and tightens. Now that can help a little bit with some lines and wrinkles, because obviously if you're lifting, you know, you may find that some lines that you have will smooth out a little bit and things like that. But it's not really an anti-wrinkle device. It is a lifting and tightening. So it's more about trying to get a bit of definition back through your jawline, trying to get your cheekbones back a little bit. You know, you get a little bit of lifting on the upper brows, along here, and also under the neck, which I think is actually a big
definitely
one.
That bit.
So across this area as well, we can try and get a bit of lifting. So that's the Haifu. And then the radio frequency microneedling, actually you can treat a lot more with that. And I'm finding it is quite popular because skin texture and skin quality are so important for many, many people. It helps with fine lines, wrinkles, including close around the eyes. We can go right round to the eye area and including on the upper eyelid, which you can't always do with certain laser devices and other things out there. You can, it's fantastic for scarring. Obviously there are some types of scarring which are going to take a lot of sessions, and you never necessarily get perfect skin, but you can get really nice improvements. Stretch marks can be treated. That kind of crepiness that you start to see, again, it's a little bit to do with as the skin sort of falls down slightly, you get sort of this bunching up here, which can make the texture look a bit crepey. Fantastic for that. Just plumping the skin out, it's a real plumper, and that does tighten the dermis and the epidermis. It doesn't have an effect on the SMAS layer, but it does give a bit of tightening and firming on the upper layer of the skin. I've also found it quite beneficial to my active acne, because obviously the heat from the RF kills the bacteria. So I found that not only has it helped some of the marks that I've had from existing sort of acne breakouts or previous acne breakouts, it has helped to reduce my the new acne breakouts coming in. So yeah, no, I've been really impressed with both modalities of the machine. The combination has been incredible if I have got clients doing both, but even individually we've just seen so far really nice results. So
good.
Very,
yeah, fabulous. So if people can head over to your Instagram page and they can book in consultations with you, and for any clinic owners watching, if you would like to get an idea as to the sorts of results you can achieve, if you just put #FocusJewel into Instagram, then you can see a range of different clinics posting their results. So it just gives you a bit of an idea as to what to expect. But as Debbie says, I think it's really important to understand that you know, no one magic pill is going to solve everything, and it's about having something which just gives you another tool in the toolbox.
Yeah, no, I'm really pleased with the device, and yeah, my clients have really been responding incredibly well to it. So and lots and lots of interest. And for me myself, it's the, you know, I've been very pleasantly surprised personally at my results, because I have so many other things done on a regular basis. To have a machine that sort of comes in and then gives you that extra bit of result on top of everything else that you've already got, you kind of think there wouldn't be much more that you could do, but it has affected my skin in a different way, and it has been a noticeable difference. So yeah, very pleased.
Fabulous, good. And let's ask the question that everybody wants to know the answer to. Does it hurt?
Okay. Actually, I have got a couple of questions here that we might quickly run through. We can ask them by our on our own Instagram pages that come down. Does it hurt? I mean, look, both modalities are uncomfortable in slightly different ways. With the RF needling, which is the little needles that stamp into your skin and then give you a burst of radio frequency, that's a bit, I tell people it is a bit spiky. It's got like a little edge to it. It's almost like it will make your eye water, but it's not painful. It's like more an irritating, annoying elastic band flick type. Ooh, don't like that, but it's okay.
Yeah.
The Haifu it does feel a little bit different because it's going deeper, so it's kind of has this more of like, it sort of feels like someone's like pulling the muscle, and it kind of spasms a little bit and stuff. But So far,
I find
it's
it
been
quite
bearable.
tingly. It's an odd sensation, isn't it? It's really
Yeah.
quite, it's a bit odd. Again, I wouldn't describe it as painful. I'd describe it as a bit uncomfortable at times, but sort of a
We,
tingle almost.
yeah. Yeah, so definitely bearable. I mean, with the RF needling, if someone really wanted to, you can obviously have a topical anaesthetic on to make it a little bit more comfortable. But a lot of these things, because you're going that little bit deeper, the anaesthetic takes the edge off, but it's still not going to, I mean, it wouldn't work for the Haifu at all because the Haifu is going too deep. So
Indeed.
I definitely think it's a good, a tolerable treatment for the result, for sure.
Yeah. Yeah.
Um,
We've been through
someone
much
said,
worse, haven't we, in the name of
oh God,
looking good.
I had one of the very first full-on resurfacing lasers about 17 years ago, and oh my God, that was pretty full-on. Okay, here's a couple of questions then. So, can it be done only on specific areas? I mean, it depends which one you're talking about. So obviously, Haifu is for lifting. But we do have a specific cartridge which is for the body, so that can be used for areas of the body again to create a little bit of tightening and firming in those areas. So you could do sort of upper arms, you could do a little bit on the tummy, not for massive areas, but I think it can be targeted. The radio frequency needling can be done on any skin that needs retexturizing, so crepiness, so definitely chests. I did someone's back of hands yesterday, sort of maybe crepey knees, definitely stretch marks, and of course all over the face. So yeah, we can treat skin as skin, we can treat it wherever it is, for sure. Will it help with fine lines and wrinkles? We've already gone over that. That's more the radio frequency side. Will definitely help with fine lines and wrinkles. The Haifu can help to soften them, but it's not specifically for that. Can you have it around the eyes? Again, with the Haifu, we do sort of we don't go within the bones, where you feel the bone is, we don't go inside that, but we do sort of sweep around the eye and we go above the eye. So that does give you that little bit of tightening there. With the microneedling, we can actually go on the eyelid and we can come within that orbital rim, which is really, I found that very beneficial because I've just got some very fine lines under my eye. I don't have the sort of the, crow's feet and stuff like that yet, but I did have that. So I found that worked really well. Can you have RF microneedling on a regular basis? I mean, yeah. Whether again, it's down to each individual to kind of work out how often they would need it, but you probably could have it done without any problems every 6 weeks or so if you wanted to. I normally say to people when they're on a maintenance program, it's 6 to 12 weeks to have a one-off session. Is that your experience?
Yeah, I agree. I think it depends obviously on the how you tweak the needle depth and the RF power that you're using. If you're using quite low settings, then potentially you could do it every 4 weeks. It would just be like microneedling. But I don't know whether you'd really need that. I think you'd be getting fabulous results if you were having a top up every 6 weeks or so. Yeah, for sure.
Okay, so how effective are they for pore size and scars? So I'm assuming that means the radio frequency needling. I found it really good for pores. Probably one of the only treatments that I've had done that I've really noticed an improvement in my pores. And that includes all the resurfacing lasers and things like that, which always make my skin look great, but never really had an impact on my pores. Scars, yes, you'll definitely get some improvement, but again, it's an individual, it's case by case basis for whether or not someone is suitable for these treatments and what type of scarring they've got, what other treatments they've already tried. There's lots of things that comes into it, but yes, in theory, and from what we've seen so far, scars do respond really well. Okay, and then what is the downtime? Actually, this is a really good one because Haifu, there isn't any. So you very, very rarely get a little tiny bit of redness straight after the treatment, but that goes down pretty quickly. There's no peeling, no swelling or anything. The only thing that you can do that a couple of people have fed back to me, I haven't had it myself, is a slightly aching sort of jaw, almost like you've been chewing too much. and that can last sort of even up to a week, but it doesn't hinder you in any way, and no one else can see that. It's just more of a feeling. The RF needling, I mean, I can't believe how quickly people do recover from it, considering the results that you're able to get from it. But you do go very red when you very initially have it done. Quite a lot of people, the redness is gone within a couple of hours. But I do always say 24 hours just to be on the safe side, because there are obviously people that can be more prone to staying red for longer. Most of the people that I have seen have, everyone that I've done the treatment on have said the redness has been gone definitely by the next day. So that's been fabulous, but always plan for a little bit longer for your first session or two, just in case. And then you get that kind of dry, rough kind of texture to your skin for about another 3 to 5 days. So I would say it's a week in total for you to sort of say, okay, my skin's going to be pretty much back to normal after a week, but very, very manageable for that week. You know, extra moisturiser and a bit of makeup.
It's not a take the day off work sort of downtime, is it? It's not a, you know, you'd worry about picking the kids up from school downtime. It can, you know, it's not social downtime as such, but your skin won't be as normal for that time period until it recovers fully. The one thing about the focus jewel, it's interesting you say, you know, you're surprised by how little the downtime is in comparison to the results that you achieve. And it is just small tweaks, and this is the case, is the longer technology is on the market, the more that you can improve it and tweak it slightly. And that is down to how thin our needles are. So the needles in the focus jewel are ultra thin, so you create a little bit less trauma, so to speak, but still with enough of that bulk heating with the RF to give you the lovely result. Also makes it a little bit more comfortable as well, so thinner needles.
No, I have found it very bearable to have done, and most of my clients are doing it without the numbing cream, without any anaesthetic. So it has been fine to do. Whereas I know that when you do have those slightly thicker needles, I think you're pretty much using the numbing cream for most of your sessions, because it is just that little bit too far. And this is on the bearable spectrum, but just. And if it was a little bit more, I think we would have to be getting people to put their Emla on before coming in and stuff. So definitely a good treatment from that perspective. Did we want to see if anyone else wanted to ask questions, or are we ready to wrap up?
Yeah, we can see if there's anyone in the audience with a question.
If anyone has a question, feel free to ask them now. I've gone through everything that I can think of, but there will always be someone out there with something good to tweak our things. No, it doesn't look like anyone's asking any questions, so I think we're going to try and save this chat anyway. I say we, obviously my assistant, who knows what they're doing, is going to save it. And yeah, so you can reference back to it. And if anyone does have any questions in terms of the treatment side of things, I'm more than happy to answer them. So you can send us a DM message. But if you have anything technical to ask, then you need to obviously go to Linton directly. Okay, we have a couple of questions. How's it different to what's on the market? We have already answered that. It is in the way that the energy is delivered into the skin. It has got a couple of differences. So the one for the RF needling is that the needles are much finer, so it makes it a more comfortable and a quicker recovery treatment. The Haifu itself, the delivery system, again, just gives us that extra safety in terms of how the energy is delivered in, and the reducing any side effects that can potentially be caused by these type of devices. Wearing makeup after RF, you wouldn't want to do it straight away, but you can do it from the next day. It's no problem. I mean, we do in the clinic have specific post-procedure makeup that can be worn straight away. It's a special clinical makeup, but really, if you can leave it off the skin for sort of a few hours, then that would be ideal, just to allow those microchannels to close up. So Okay, I think that's
Super. Well, I look forward to seeing you tomorrow.
Yes, we will be there, all ready to go.
Fabulous.
More explaining. Can I have a flip chart tomorrow?
Yeah. Okay. We'll have an iPad with all the pictures on.
Okay, we've got one more. Can I have a laser treatment before or after Haifu? You would need to just space it out a little bit, but yes, a lot of my clients I'm doing, you know, they come in and they have regular actual laser and IPL treatments, and then we're now obviously peppering in and slightly changing how often we do the lasers to fit in the Haifu and the RF needling, but all of them can be done. We just have to make sure you really understand your client's skin, their tolerance levels, and create a bespoke treatment for them. But I would say about a week would be the minimum I would want to have in between the sessions of a sort of a laser and a Haifu. But if someone is slightly sensitive, or if you're new to sort of using these sort of devices, then 2 to 3 weeks would probably be better. Haifu, how many Haifu treatments in a year? So your initial package should be about 3 treatments, and I would say ideally within a 4-month period would be the optimum, but certainly within 6 months, and then you can have it every 6 to 18 months. Yeah, you can be. If you were getting good results and you're happy to have the whole 3 every 6 months, you could, but I don't know if you necessarily would need to. It's more you do your initial 3, and then every 6 months you would just have a one-off session to kind of top it up and maintain it. Unfortunately, pregnancy and breastfeeding is we don't treat during that time. Not that it would do anything bad at all, because the technology doesn't go through the body. It's just your skin is always more hyperreactive and will behave differently during that time, so it's always best to wait until sort of hormones have settled and your skin is reacting normally again before you start doing anything too invasive or sort of overstimulating on it.
Okay.
Run away.
All right. Yes. So you can head over to, obviously, you're all watching on Debbie Thomas Clinic, so you can head over to there for any other questions that you have. Or if you have, I noticed there are a couple of clinic owners watching, if you have questions for Linton, then we're just Linton_lasers. And if you want to see some results for the focus jewel, just hashtag focus jewel.
Perfect. Thank you so much, Hayley.
Thank you.
Hope your trip down to London all goes well, and I will see you tomorrow.
Sure.
And thank you everyone who's listened in today. Hope you have a great day.
Bye-bye. Thanks.
Bye.
Bye.
Thank you.